Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I would like to talk about screening colonoscopies and whether they are really required. The contents of this video cannot be taken as direct medical advice. That would be irresponsible and also inappropriate of me to say that this is direct medical advice. It is not. The only person that can give you direct medical advice is your doctor, who knows you, your history, and your unique risk factors. My intention is to state my own thoughts in this video, tell you what my thought process is, and plant a seed in your head so that you can hopefully ask better questions to your doctor and make an informed decision. Because when it comes to screening colonoscopies, the United States is a complete outlier. Almost no other countries even do screening colonoscopies. I think there are a handful of countries, but not many amongst Western advanced nations. And why does the United States have these current recommendations? I believe they currently reduce the recommendation from age 50 to age 45 to have a screening colonoscopy, again, way out of line with other countries. And I've talked to you before about my own belief that unfortunately the healthcare system in my eyes is a complete scam when it comes to many different issues. I do my best, even though I'm a doctor, I have no interest with interactions with our healthcare system because I know what comes next when you are a patient and you get set on that merry-go-round. I do my best to stay away. Okay, for acute situations, I think our medical system can be amazing. But chronic and preventive issues, there are a whole load of question marks. And I have no intention whatsoever of having a screening colonoscopy. In the absence of any symptoms, I do not believe they are necessary, which is why most countries don't do them. Let me share this with you here. So here we have an article published by the Lown Institute from March of last year. Why are screening colonoscopy recommendations different across countries? If you live in the US and are nearing middle age, you'll probably hear a lot about the importance of getting a colonoscopy for colorectal cancer screening. Because of this emphasis on colonoscopy, Americans may be surprised to learn that other countries consider routine colonoscopy screening for cancer to be overuse. Cross-country differences. So they talk about here how routine colonoscopy is recommended in the US as a first-line screening method, but not in other countries. A key issue is the lack of high-quality evidence demonstrating the superiority of colonoscopy compared to other screening methods. And that is very true. Usually in other countries, other screening methods are recommended, including occult blood testing. Of course, things may be different if people are having active symptoms or have other unique risk factors, but routine screening is not recommended in many other countries, including the United Kingdom, Australia, Canada, France. There are only a handful of countries in the world which recommend colonoscopy as initial screening. And I firmly believe that if you take money out of the equation, the fact that these colonoscopies are generating millions and millions of dollars as thousands of gastroenterologists all over the country are doing them routinely. If you took the money out of the equation and you made it free, let's see how many routine colonoscopies are really recommended. I believe the only reason the United States is so aggressive is because of this cash incentive to do more colonoscopies. And colonoscopies are not without risk. So I believe that in the absence of any symptoms, including a change in habit, bleeding, etc., routine colonoscopies should not be a universal recommendation, which is why I personally, when the time comes, have no intention whatsoever of following the United States recommendations. If it was that important, other countries would be doing it. And many other countries which don't do routine colonoscopies have lower rates of colon cancer and improved survival after diagnosis than the United States does. So explain that to me. On the other side of the coin, the United States has one of the worst junk food cultures of any nation on earth. So that increases the risk of many gastrointestinal cancers, including colon cancer. So I suppose that should play into it as well. But you would think if the authorities in the United States were so concerned about colon cancer, why don't they go all out with a public campaign against this toxic ultra-processed food culture? No, of course they won't, because there's not much money to be made with that. The money is to be made with more procedures, more tests, and more treatment, which is exactly what you're seeing. Toxic, pro-inflammatory junk ultra-processed food does many other things, including altering the gut microbiome and promoting obesity, which are also risk factors for developing many cancers, including gastrointestinal cancers. So my first piece of advice to anybody would be to reduce that toxic pro-inflammatory ultra-processed food being fed into your gut. Beyond that, when it comes to cancer screening of any description, please speak to your doctor, assess your unique risk factors, your family history, and then make an informed decision. But please know this, the United States is a complete outlier. I personally won't be following recommendations, but each one of us has to make our own decision when it comes to any procedure or intervention. What are the risks versus benefits? And also understand, if you're in the United States, that the USA is currently an outlier. Most countries don't do routine colonoscopies, and these are advanced Western countries. They focus first and foremost on any alarm symptoms, including a change in habit, any unexplained weight loss, any bleeding, all of those symptoms which are worrisome, and then getting checked out ASAP so that if there's a problem, there can be an early diagnosis and early treatment. Thanks everyone for watching. Feel free to comment down below. Let me know your thoughts. Check out my free newsletters and my Uncensored platform. Those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. We will speak again next time.